Peritonitis Protocol. So we have a standard operating procedure. It is RD 5645. So some of the symptoms of peritonitis would be if the patient came in and they complained that they had a cloudy drainage or effluent, pain, diffuse abdominal pain, constipation, diarrhea, fever, nausea, vomiting, so a lot of vague symptoms. If a patient comes to the ER, to the unit for peritonitis protocol, we do have a bag made up in our cupboard above the warmer for peritonitis protocol that will make things easier for you. The only thing that you would need to grab would be the caddy with the Alka-Vis, has the gauze in there, all that stuff is in here, but pretty much the Alka-Vis and gloves. The one thing to remember, it's on the policy, is that there needs to be a minimum of a 2-hour dwell in order to take a sample. If a patient comes in and says, I've had fluid in since whatever time, if it's been more than 2 hours, even if it is the icodextrin, that fluid can be drained and sent directly to the lab for the cell count. For peritonitis protocol, there is a smart set which includes the labs, so the cell count, the microgram stain, and if there is drainage on the exit site, there's also a wound culture that you would release for that. The process for filling and draining, I'm going to go through a demonstration. The first thing that you're going to do, as we do for all peritoneal patients, is wash our hands for 2 minutes. I have washed my hands for 2 minutes already today, so I'm going to just continue using the hand sanitizer. Okay. I have all my supplies laid out, and the supplies are listed on the SOP. And make sure everybody in the room, including the patient, is masked. I'm going to put a drape under my transfer set. This is just a regular drape. I do have my ultra bag. When you are going to fill a patient, you will either use the 1.5% or the 2.5. There is no reason besides the cost effectiveness of not using the 7.25. So like I said, we'll gather our supplies. I'm going to open my gauze. Use my Alka-Vis. Saturate that gauze. Sanitize your hands. Apply your gloves. You'll take your Alka-Vis soaked gauze and you're going to scrub your transfer set for 1 minute. So at 1 minute, then we'll wrap it and hold it tight. We want the bleach solution to get in those crevices. We hold this, let it soak for 1 minute. Once that 1 minute is up, we remove our cap from the ultra bag, the mini cap, keeping both ends sterile. You'll need 2 ultra clamps, which are these red ones. You'll put one on your fill line and one on your drain line. I am going to drain first. So we'll open our transfer set. And if the patient has any fluid in, Even if it's just a little bit, that will drain out first. This patient came in dry, but we do still try to drain first. She didn't have anything to drain. I'll close the transfer set. Using my spring scale, I'm going to drain my ultra bag to what my fill volume will be. If a patient will tolerate it, I recommend 2 liters or their fill volume. So you can drain this to the 2 liters. Once that's at 2 liters, clamp both your lines. Open your transfer set back up, and then fill the bag with the 2 liters. That would take approximately 10 minutes depending on the patient. So once your 2 liters is in, you'll just clamp your fill line. Your drain line, of course, has been clamped this entire time. And this is when the patient is going to sit and dwell for 2 hours. So note the time that you finish. You'll get your gauze, your Alka-Vis, and a mini cap. Sanitize your hands. And you close the twist clamp on the transfer set, and again, you'll scrub around your transfer set for 1 minute. Once it's been scrubbed for 1 minute, you'll wrap it and let it soak for 1 minute. 1 minute. Get your mini cap. Remove the ultra bag. Replace it with your mini cap. Tape it per the patient's comfort and let that dwell for 2 hours. The rest of this solution can be discarded. After 2 hours, you're going to use a manual drain bag. On your manual drain bag, there are 2 connections. Just remember that the short one is the one that you're going to hook to your patient. Clamp both lines and have that ready. You'll have your Alka-Vis soaked gauze. Again, you'll scrub for 1 minute. Let that soak for 1 minute. Once that 1 minute is up, you'll remove the cap from your drain bag, the mini cap, and attach the 2. This will all work through gravity, so you'll put your bag on the floor or on the lower part of the IV pole, and you'll let that drain. So after your patient has everything drained out, what we're going to do is disconnect this bag from the transfer set. You'll have your gauze and your mini cap. Close your transfer set. This line has a clamp on the drain line, the patient line. So you will, again, scrub for 1 minute. Soak for 1 minute. And remove your bag and apply your mini cap to the transfer set. Then you take a look at your drainage. If you can see through it, we call it clear. This is quite cloudy. Before you take the sample, we want you to slowly mix the sample. I find it best to hang your sample back on the IV pole. Have one red clamp. The line that you disconnected from your patient, I recommend just putting a red clamp on that. It'll make things easier for you. For your cell count and your cultures, you'll need 2 Falcon tubes, a red top, and a purple top. You want to keep your Falcon tubes as sterile as possible. You remove your caps aseptically, set them down, and you'll use the other line from your manual drain bag, keeping that clean. You'll just open both lines and fill your Falcon tubes first. Fill them as close to the top as possible without touching the inside of the Falcon tube. Once they are both filled, you're done with this, so it doesn't matter if it gets contaminated. You'll take a 12 or 10 cc syringe with a blunt tip needle, and you're going to take between 4 and 6 mils from each Falcon tube aseptically. And then replace your caps without touching. Tighten those down. You can change out your needle, your blunt needle, to a sharp needle if you would like. The blunt will fit into the lab tubes. And then you just fill your tubes. Discard label. Put your labels on your tubes and hand deliver these to the lab and let them know you have stat cell counts to be done. While you're waiting for your cell count results, do a dressing change. Look at that exit site so you can see if that needs to be cultured with a Q-tip. Do a dressing change. The cell count takes about 30 minutes for the results to come back. On your SOP, it tells you how to label them, hand deliver them, and put in a .pd cell count smart phrase and send that to your PD home staff. Once the cell count comes back, and it is in here, if the cell count is greater than 100, it is positive for peritonitis. You will notify the on-call nephrologist if it's a holiday, weekend, or night, or the primary if it's during business hours. And they will inform you of their treatment choice.